Good afternoon. It is Saturday afternoon. It's 4 o'clock. It must be time for the senior moment. Hi, this is Connie Clark with Home Helpers, and this afternoon I have a very good friend of mine, Patty Petersen. She is a registered dietitian with a master's degree in human nutrition from the University of Utah. And she's had, I won't say many years because she's very, very young, but she has many years experience as a hospital clinical dietitian. And most recently, she's been writing articles monthly for various newspapers on nutrition topics. So welcome, Patty.
I'm so happy to be here, Connie. And thank you for the generous introduction.
Absolutely. I am so glad you're here. I have been trying for a very long time to get you to come talk to me. So I'm glad you're here today. What I want to talk about today is metabolic syndrome. And I heard you speak a few months ago to another group of folks talking about this. And it resonated very personally with me because some of the things you were talking about, I was able to identify with. And so I went back and started looking at some of my numbers, and it kind of concerned me, So what you said really hit home for me. So why don't you tell everybody, what is metabolic syndrome?
Well, metabolic syndrome is a term that's used to describe a group of diseases that affect nearly half of all adults and children in Western countries. The four diseases are insulin resistance, dyslipidemia, obesity, and hypertension. And these four diseases together are known as metabolic syndrome.
Why? Is this something new that all of a sudden has started happening to us, or has it been around? Because I don't remember growing up ever hearing this discussed.
Well, it has always been around. These diseases have always been around, but it was in the 1980s that doctors began to see that these four conditions often existed together, and they used the term Syndrome X. Later, they began calling it metabolic syndrome.
And so they would see someone who was insulin resistant, and coincidentally, all these conditions kind of existed at once.
That's right. And, yes, and it is really important, an important topic for seniors to know about, because nearly all seniors, or those age 65 or older, either have metabolic syndrome or they're inching closer to having metabolic syndrome every day.
Okay. So you have these four different things, and you have metabolic syndrome. Does that make your lifespan shorter, or?
Oh, absolutely.
Okay. So it would contribute to your declining health.
Right.
Okay. So let's talk about each one of these separately. Because some of them I'm sort of going, okay, yeah, I think I know what that is, but some of the larger words I'm not sure. So talk about each one of the four different things and what those are.
Well, insulin resistance is the first one that I mentioned, and it is a term that means that the body's cells lose their sensitivity to handle insulin. Insulin, as you know, is a hormone secreted by the pancreas. And the normal fasting blood sugar should be less than 100 milligrams per deciliter. But a fasting blood sugar after a 12-hour fast that is between 100 and 135 milligrams per deciliter indicates pre-diabetes. In other words, there is insulin resistance going on, and the person is heading toward becoming a diabetic.
So when you say insulin resistance, that means that they have excess sugar in their system and their body's not using it.
Their body's not using it.
Okay. And that's something real easy that you can test. You can, when you get your annual exam, they're probably going to have you fast, and that's one of the things they're going to test for. And I remember when you talked a few months ago, and as we go through all these things, I think it's something to keep in mind. You had said that when you go to your doctor and you get all your tests done, you'll get a phone call a few days later and they'll go, "Oh yeah, you're fine. You know, you're within range." But one of the things that you pointed out in your talk was that, yeah, you're fine, you're in range, but last time you were 96, and the time before that you were 95, and the time before that you were 94. And so your numbers are inching up, and you not knowing those specific numbers, you don't know that.
Right. And I think that it behooves everyone to keep a record of their own levels.
So that you know.
You have changed over that year, and it's not for the good.
And I think that's really important because I started doing that. I went back and I did not have those results. I just had the yeah you're okay kind of results. So the next visit that I went to my doctor, I asked them, let me have my lab results for however long I've been going here. And they were able to give me copies of those. And I sat down and I wrote them down. You know, I made a little chart, and each one of the numbers I wrote down, you know, what they were. And so I was able to see my history and where I was going with those numbers.
And I think your doctor really appreciates that you are taking charge of your health and these numbers. I think all doctors appreciate that you're interested and that you're keeping a record.
Because it's really important, because even though they say, yeah, you're under the numbers, and that has to do with a lot of the other numbers we're going to talk about, it's very important to know what direction they're going.
Mm-hmm.
You know, because, yeah, you might be within range, but are you closer to that borderline than you were the time before?
And another measurement that we're not listing here as part of metabolic syndrome, but is just your body weight. And you can see that maybe you've increased a pound or two each year, and it's a good time to reevaluate.
Oh, and it sneaks up on you, too. Because you don't really recognize, you know, over a year you've gained 5 pounds, but in over a year you've gained 5 pounds, you know, and if you do that again next year and the year after and the year after, that's going to cause problems. So I just wanted to kind of point that out, that, you know, the numbers we're talking about, don't just look at your snapshot now. You had talked about looking at your history, and you can see what direction you're going in. I really like that. So I didn't want to jump in there and interrupt you, but I think that's really important.
No, I'm glad that you pointed this out, Connie, because that really means a lot, that you have figured out that this is a beneficial
absolutely
for your own health, to take charge of your own health.
And see what direction you're going in.
And see what direction.
So you look at your insulin resistance and see what your glucose number is when they test your blood. What are some of the other indicators that you talked about?
Well, on the subject of insulin resistance, just another statistic. In the United States, more than 75% of people 65 years and older have diabetes or pre-diabetes. So that's a huge number.
There's a lot of seniors that are there.
Right. They're already there, and they're suffering from this
disease. And to have diabetes, I mean, this morning and this afternoon was the Diabetes Health Fair at Panhandle, and that's what it was all talking about, was diabetes. And if you were there, you've learned out so many things that diabetes does to your body. It just really destroys it. So it's important to try to stay away from that.
Yes, very important. The second part of metabolic syndrome is dyslipidemia, and that means that your blood fats are out of order. And that is diagnosed with a fasting blood test. And it is a measure of the levels of fats and cholesterol in your blood. The first part of that is the triglycerides. Those are fats that are found in the blood immediately after a meal. So that's why you have to be fasting. If you are fasting and your triglycerides are greater than 150 milligrams per deciliter, that is a red flag. They also measure your LDL cholesterol. And if that is high, over 135 milligrams per deciliter, that is too high. Your HDL cholesterol, they call your good cholesterol, and that should be low. It should be 40 for men, no higher than 40 for men, and or at least 40 for men and 50 for women.
So it could be higher than that.
Yes,
Okay.
and that's good.
And that's the good number.
That's
You
the
want
good
the higher number. Okay.
And your total cholesterol of over 200 is considered too high. So all of those numbers will be found on this fasting blood test. And if this dyslipidemia is treated with medication, the goal is to reduce the LDL cholesterol to below 100, or in a very high-risk individual, such as diabetics, you want that LDL cholesterol to be less than 70.
Oh, my goodness. That's really low.
Mm-hmm.
Okay.
And moving on to obesity is the third disease in the metabolic syndrome. And you can define obesity as a body mass index of over 30. And you can Google a body mass index chart.
And that's a relationship between your height and your weight. And they make that with a complex formula, so it's easier just to Google BMI chart on the computer and go in there, and you can plug in. Does it separate male or female, or is it just bodies?
Not really.
Okay.
The difference would be if it was a child.
Okay.
And the body mass index chart has to be converted to a percent chart.
Okay.
So you stick with the adult.
So you just go in there and look and see how tall you are, and then go down and see how much you weigh, and you can tell what your BMI is there. But that's not the only thing. It's not just height and weight. There's some other stuff, because you can still be within that lower than 30 and still be at risk, correct?
That is correct. But the single most revealing measurement is your waist circumference, and all you need is a tape measure. And
high tech.
Yeah, high tech. You can do it yourself. And men who have a waist circumference of greater than 40 inches, or women who have a waist circumference of greater than 35 inches, are considered to be at risk. That is called abdominal adiposity, and that is fat stored through the middle section that is pathological fat.
So you could still be within that 30 range, but if your waist measurements are bigger, you're in trouble. And that would be versus if you had they talk about like pear-shaped people, where you had a little tiny waist, but all of your weight is in your hips.
Right.
Or your legs.
That is not as much of a concern as the fat that is stored throughout the abdominal or waist area.
And is that because the fat is by your organs?
Yes,
okay.
It is. And if fat is distributed throughout the body, that is not as much concern. But the fat distributed throughout the abdominal or waist area is of concern.
Okay, so all right, I'm trying to picture body shapes, because a lot of times what you see in seniors is they'll lose their muscle on their arms and their legs because they haven't been using them as much, and all of their weight is in the trunk of their body, and that's really not a good thing.
That's
because
not
then
healthy.
it's messing with all their organs, and it's causing a major problem.
Mm-hmm.
Okay.
And numbers slightly less than that are probably indicators of pre-metabolic syndrome.
Okay. All right.
We probably should discuss the growing problem of obesity just at this point. And on a personal level for people, obesity has very serious health consequences. It increases the risk of developing diabetes, heart disease, certain cancers, and, of course, joint disease. On a national level, obesity raises the medical costs by about 50% for each individual.
Wow.
Over non-obese people. The estimated annual cost of treating obesity in the United States for adults, non-institutionalized population, is $168 billion.
Good grief. And it's something, because we could go on talking for hours about the obesity situation, but you know, as our seniors were growing up, you know, a lot of folks were on farms and stuff, and so they ate a lot healthier. And then as they're growing older, now all these situations are happening to them. And what I see happening is, you know, you might have someone who's now living alone and they don't want to fix a big meal, or they don't, you know, go to the store that often because of the weather or whatever. And so you have people eating convenience foods, microwave foods, canned soups, that sort of thing. And those are not really good for them because of the high sodium content and that sort of thing, which kind of, yeah, they get some food, but it's going to make their blood pressure get larger. It's going to work on their diabetes, you know, that sort of thing. So, and then you look at the population coming up who's only been eating junk food, and, you know, they're larger in size than previous populations. So this is going to be a major thing happening um, in our
Well, it
population.
really is, Connie, and I'm glad you pointed that out. And we do need to talk about what dietary changes we can adopt to watch this. But maybe first we should the fourth.
Okay, yeah, I want to
Yeah,
get to the
we want to
fourth
get
one,
to our
and then
fourth.
after the break, we'll talk about some of that
We'll
other
get
stuff.
into what we can do about all this.
Okay.
But the fourth is hypertension, high blood pressure, which is defined as 130 over 80. If you've
Okay.
reached 130 over 80, you now have high blood pressure. It affects 1 in 3 U.S. adults. 75 million people aged 20 and over have high blood pressure.
Wow, age 20, good grief.
From age 20, another 50 million adults suffer from pre-hypertension. So we're talking about a lot of
A lot of
US
people. And again, what I was saying, you know, the population that are, I think, experiencing this a lot are our seniors, but this is going to become more prevalent as the baby boomers come up and then the generations after us, simply because of what our diet's been and our numbers have been. So the four things that we've been talking about is the indicators on your glucose level when you go to the doctors and you get your glucose test, your cholesterol levels, and it's all of them. It's your triglycerides, your good cholesterol, your bad cholesterol, and the total. The weight, your BMI over 30, and then your waist measurements. And the last one is your blood pressure. And those are things that when you go to the doctor, they check those every time. And so it's going to be real important, like what we were talking about, to keep track of where you are with those numbers. Because if you're inching towards there, it's best to, you know, I always say it's best to fix the flat tire before it goes flat, you know. So it would be best to address these issues before you actually have it. So we're going to take a break, but I want to come back and talk about each one of these things and then what we can do to maybe avoid them happening to us.
Sounds good.
Okay, so we're going to take a break and we will be right back. It's okay. That's okay.
Was I reading too much?
Well, now you won't be.
Well, I still have my.
We're fine.
I hope my voice.
You're good. You're good.
You're darling. You really keep that conversation.
It's just a conversation,
It is.
you know, and that's why we're just going to sit and look each other and talk and have a conversation. Okay? Um, so let's go back and let's talk about, okay, insulin resistance. If your numbers are going up on your blood sugar tests, what can we do?
Well, you're first going to concentrate on diet,
Okay.
changing your food intake, and I can comment on all of that.
Okay.
And then you're going to introduce an exercise program.
All right. Well,
And
what
then
what I'll do is
medication's the third.
okay. What I'm going to do is I'm going to say each one of them, and then I'm going to ask you, what can we do to do that?
Okay, so we can spend quite a bit of time. I still want to do the salt stuff that comes along with the hypertension, but we should talk about salt.
Okay, well,
and its relationship to hypertension.
all right. Well, we'll talk about that first before we go into each one of them then. Okay?
Okay.
You ready? Okay.
Yeah.
And we're back. Welcome back to the Senior Moment. This is Connie Clark with Home Helpers, and today I've got Patty Petersen in here. She's a registered dietitian, and we've been talking about metabolic syndrome in seniors. And we talked about the 4 different indicators or groups of indicators that make up metabolic syndrome. And one of the things we started talking about before the break was high blood pressure. And Patty, you wanted to say some things about salt and its relationship to high blood pressure. And I had mentioned about how seniors oftentimes eat frozen foods. They eat canned soups, and those things are loaded with sodium. So, what should they do? I mean, they don't want to cook a big meal, but and what does salt
That's
do
right.
for?
Well, we do first ask what role does salt play in hypertension? And we know that, first of all, the typical American diet contains way too much salt, probably twice as much salt as we need per day. We all do need salt. Athletes need to be concerned about salt intake, and people who work outside need
And
to
that's
be.
because when you sweat,
You're losing
you're losing salt.
or sodium.
Hmm.
And so the present recommendation is about a teaspoon per day, or what would be considered 2,300 milligrams.
Is that a
but
teaspoon, 2,300?
1 teaspoon is
Okay.
2,300
Okay.
milligrams approximately. But those who need to reduce their sodium intake because they are hypertensive should lower that sodium intake down to around 1,500 milligrams.
So that's
So
about half a teaspoon.
About half a teaspoon. But we get the excess salt in our diets, in our processed foods, or our restaurant foods, or fast foods.
I remember looking on a can of soup, and I think it had something like 980 milligrams of salt in it. Uh, and I just thought, oh my heavens. And that's almost your full day in one little bitty can. I can't have any salt on anything else ever for the rest of the day. That's just crazy.
That's right. And it is salt is sodium chloride, but there are many other forms of sodium in our diets, and we can look on our food labels, and you look on the food label for the percent daily value for sodium, and you want to look for foods that say less than 5% of your percent daily value for sodium. If it's above 20%, it's too high. So I would eliminate those foods.
That's easy to look at. You don't even have to figure
You don't have to
the
figure
milligrams or whatever. Okay.
Right.
Okay.
But we will get into a little more of a discussion
Okay.
on diet when you're ready, and we'll talk a little more about.
Okay. All right. So one of the things that we talked about that was part of the metabolic syndrome is insulin resistance. So I'm going to my doctors and I'm looking at my numbers and I'm charting them and keeping track, and I see that number inching up closer and closer to 100. What do I do?
Well, you'll probably also notice that your weight has increased.
Well, I wasn't going to talk about that.
Okay, we'll talk about and you may need to just stop right there and consider your dietary intake, your exercise or lack of it, and basically begin making some major changes. It's a wake-up call.
So does that mean I can't have anything to eat that has sugar in it, or should I don't know. Tell me.
Well, you need to you need to evaluate what you are eating, and it's a good way to take stock of what you're doing. You can keep a daily charting of what you eat, how much, and then you maybe notice a trend that you're overdoing it in some areas. But we're going to probably look for just an overall healthy way to eat, not following any particular diet. You can look at diets that are high in lean proteins, low in carbohydrates, high in fruits and vegetables, and when you do have carbs, have whole grain carbs, and fish. And eating a lot of fish is good. You can eat eggs. You can have at least one whole egg a day, and I personally think that more than that is also fine. The Mediterranean diet is one that is really popular and is a sound and good diet to follow. There's books written about the Mediterranean diet. The paleo diet is less known, but also is a maybe more radical plan to follow, but is popular for giving good results. The DASH diet, which stands for Dietary Approach to Stop Hypertension, that is a diet for hypertensive people, and it has high amounts of whole grains, fruits and vegetables, moderate amounts of low-fat protein, and low levels of fats, sugar, and sodium. Other health experts think that a high-protein, low-carb diet that is low in saturated fat, trans fat, cholesterol, sodium, and simple sugars or sweet things is the way to go.
So when you're talking about simple sugars or sweet things, are we talking about you can eat an apple versus a piece of candy?
Right.
Okay. Okay.
And I think another problem in the Western diet is the high sugar sweetened beverages. And people walk around with a big gulp cup and
I know my daughter, she stopped drinking sugary drinks all day, and she dropped like 20 pounds within a couple months, and that's all she did was just stop drinking that.
and that's going to have a major effect on your blood sugar and on your weight.
So when we talk about what we can do for each one of these things, there's not any one thing you do that's going to affect just one of them. It's kind of going to affect everything because they're all connected to each other.
They're all connected, and it's just changing your habits to be a more healthy person. And probably one of the most important things is that you have an exercise program that you follow. 30 minutes of moderate to intense exercise 7 days a week.
All right, I'm a lazy person, and I really have to ask you this question. If I eat right, okay, and I don't eat the garbage foods and the processed sugar and all that, I'm trying to, I guess, figure out in my mind how I can get out of having to exercise. So what good does just exercising do?
Oh, exercise speeds up your metabolism. It increases blood flow to your extremities. It sharpens your mind, and it's fun.
Maybe after a while, but not initially.
But you can start with a moderate walking. Brisk walking is excellent.
So are you talking just getting your heart rate up?
Just getting your heart rate up.
Okay.
Just getting out, getting a good pair of good fitting shoes, and getting outside or in a gym. Walking on a treadmill is excellent. Any kind of just 30 minutes of good brisk exercise per day. But 30 minutes is a good starting point, but it is much better to move on up to 60 minutes a day. That is going to be much more effective to bringing all of your levels into
And
healthy range.
And that's going to affect your glucose level by just doing that?
It will absolutely affect your glucose levels.
Okay.
So if you do, as a senior, begin an exercise program, you really need to clear this with your doctor. I would start there first, and because you may have some limitations.
And I know Panhandle Health District has sponsored a number of the fit and fall prevention classes for people who can't really get up and move around a lot, but at least they're moving their body parts. And that would, I would assume, increase their heart rate.
Yes, it would.
By just moving their arms and legs sitting in a chair.
And seniors do have joint limitations, and so you can't just hop up and run a marathon. But so it's good to talk to your doctor, have everything checked out, and then when you do seek professional help, physical therapists and other specialists in the gym can help seniors develop a safe routine that may also include weight training.
I know I've gone to classes over at the Croc Center where you're in the pool and you're moving. And what they'll do is they'll give you styrofoam weight things so that you're not lifting them up above your head like you would weights. You're pushing them down in the water, and the resistance of the styrofoam wanting to float back up is the equivalent of weights. So even if you are a senior who can't go out and lift weights or whatever, you could at least go to the Croc Center or McGrain Center or some of these other places where they do have classes in the water, so it's easier for you to move, and you can still do the weight bearing with the styrofoam dumbbells and all those things.
Yes, I think the Croc Center or any gym that has a pool usually have what they used to call aqua size, but it's a nice way to exercise and a nice way to move, and just about everybody can get in a pool.
Well, and it's easier on your joints.
It's easier
on your knees
joints
and stuff. Yeah, absolutely. So I'm gonna eat better. Okay, no more, junk food, which I've been real good. I've been, trying to do this right. But now you're telling me I have to exercise, so I have to, and that's going to be hard, especially with winter, because you can't now go out in the evenings because it's dark early and it's cold and it's ice and all that sort of thing. So you're going to have to go somewhere where you can, and you can walk in the mall. I mean, go over there or the Croc Center, or like I said, the McGrain Center over at Kootenai Medical.
And I think it's a fun way to socialize as a senior, especially if you live alone, to have somebody, a group that you meet at the mall, for example, as you mentioned, and walk and talk, and it's a stimulating thing. You feel better, and then you can stop and have a fresh fruit.
I was going to say, not something bad.
You're not going to have a donut.
No donuts or no Starbucks with all the sugars in them. Okay. So I see another thing on here, and it talks about medications. They've got medications that can help with some of this stuff too, right?
Well, sometimes it becomes necessary to take medications for the management of metabolic syndrome. And when diet and exercise have not been effective and your physician is concerned that you need to get some of these levels under control, he may put you or she may put you on oral drugs or insulin for diabetes or statin drugs for high cholesterol. So those are highly prescribed medications, and sometimes it's necessary to use those.
And if you put on the medications and then you start doing the diet changes and the exercise changes and those numbers come down even lower, can they take them off?
Yes, you can.
Okay.
You can be off of your insulin.
So you don't
and
have
off
to
of
be
your
on
statin.
that forever.
That is right.
Okay. All right. Well, let's take another break. But I want to keep talking about this because it's really important for people to understand how these four things connect to each other. And that when you treat them together versus separately, because they're really going to affect each other.
That is right, Connie.
Okay, so we're going to take a break and we will be right back. Do you have any other things you feel passionate about you want to talk about?
Um, well, I think maybe to take a positive attitude and not think, oh, I'm going to have my favorite foods taken away and I'm going to have to be put in some kind of a exercise,
Mm-hmm.
which feels like punishment, and to, or to be prescribed medications and that have side effects. And I guess, if there's some way to say, no, you're going to feel better. You're taking charge of yourself. This is a positive changes.
Okay.
Um, I mean,
Okay. Okay.
you know,
Okay. All right.
I don't know if you want to. We don't want to get into vitamin K and stuff like that.
Okay. That's okay. We're good. And we're back. Again, this is Connie Clark with the Senior Moment. And I've got Patty Petersen here with me this afternoon. She's a registered dietitian. And we've been talking about a condition called metabolic syndrome. And like Patty had talked about, these 4 conditions that we've mentioned here, these are not new, correct? These 4 have been around for as long as mankind. But to put them all together and show the relationship between all 4 of them, I guess the light bulb, so to speak, didn't go on until, the 1980s, you said? That doctors went, oh, wait a minute now. I'm seeing more and more patients that have all 4 of these conditions. There must be something here. And so I think then people started doing some research and showing the connections between all 4 of these different indicators that showed that if a person had all 4 of these, that there was bad things that were going to happen to them health-wise. And so I think it's fantastic that at least this has been put out to light, that people can recognize I'm not going to have to deal with, or I shouldn't be dealing with, my diabetes issue over here, and then my overweight issue over here, and then my blood pressure issue over here, and my cholesterol issue over here. It only makes sense to package all of those 4 things together so that what you're doing is affecting all 4 and not just piecemealing it, so to speak.
Well, and you can do something about it yourself. That's what's preventable about all of these things, that they are preventable, and that each individual person can manage these conditions and prevent.
So you do have control.
You have control. And it's a very positive thing, I think, to understand what is happening and what changes are happening, and to know they're not inevitable. You don't have to.
So if my family, all my family, they're all heavy, they all have diabetes, they all have high blood pressure, they all have all this stuff, I am not predestined to have this, correct?
You really are not. But we know that your eating habits and your lifestyle habits begin when you're very young. And that's why you see families that have all of these conditions, because they live together and they eat together and perhaps do not exercise, have very little activity. And then one other thing that we didn't mention is smoking. And smoking contributes to a lot of these problems. So if you think your family has all of these conditions and it is inevitable for you, it really isn't. You can make these changes.
And what you were talking about, that's how you grow up. I mean, That's where you get your recipes for different things. Well, my mother always made it this way. I've got my mother's recipe or I've got my grandmother's recipe. Well, if your entire family was overweight and you look at that recipe, there's probably lots of bad stuff in that recipe. Lots of sugars and butters and all that kind of stuff. So that's what you learned growing up.
You have learned that, and it takes willpower and it takes a desire to change, but it is positive and really pretty exciting to think that you can turn your life into an active, healthy person. I think it's such a positive message.
When I saw you a few months ago and I heard about this, and that sort of was a trigger in our family for me to start doing some investigative work, because my husband and I are getting older. I'm going to be 60, he's going to be 65 here, and so we've been looking at our numbers, and it kind of scared me to think, oh my gosh, yeah, both of us are reaching these numbers and we're getting older and we need to do something. And so we started making some drastic changes, especially after charting. Like you
What changes did you make?
We made a change in what we ate. We don't eat high-fat proteins anymore. We eat loads and loads of fruits and vegetables. He always thought that he was going to be starving because I wasn't going to have big steaks or hamburgers, things like that. He just knew he was going to be starving. And we don't do that anymore. And it was interesting because he had his blood work done and we knew where his numbers were. In fact, one of the things that really prompted was they wanted to put him on a second cholesterol medication. And I really didn't like him being on the first one. And now he was going to be on two, which really scared me. And so we started making these changes and we started seeing his cholesterol rates drop. I mean, it was crazy. It was after 3 months' time, and I had read where it takes 6 months to a year to see any kind of significant changes from changes in diet. But the amount of numbers changed that he had was enough for me to say, okay, we're continuing doing this.
Oh, that's really nice, Connie. That's a great story.
And so it does make a big difference.
It makes a big difference. And I think a lot of people will say, well, where do I start? I mean, it's confusing.
It's hard.
And it is very hard. But one of the good places to start is at your own desk and make a menu of, if you shop once a week, make a weekly menu. And while you're sitting there, not hungry, thinking about
Yeah,
this,
don't do it hungry. That's
don't
not
do
a
it
good
hungry.
thing. That's like grocery shopping hungry. That's not a good thing.
Right, and then make your grocery list from your menus. And when you go into the store, it's also helpful to write, if you shop at the same store, you can kind of know where things are and make your list so that you're not going down aisles aimlessly, but you have a purpose, and buy just what is on your list. And then when you get home, you have everything you need to prepare your meals, and you aren't going to be, just last minute things and fast foods, and you'll have a handle on it.
And it's interesting because we do that, and after doing this for several months, we would go to some event or someone's home or something, and we would have beef on the menu or whatever, and we'd eat just a little bit, and oh my gosh, we felt terrible. We just felt like we weighed 1,000,000 pounds, and it was weird how our body reacted
not fun
to it.
Anymore
No,
when you go back to the old ways.
No, it really surprised us because the first couple times that we were in situations where he could have something like that, he was all excited that he was going to get to have this now. And then he felt so terrible physically afterwards. And now he's gotten to the point where he really would rather not have that because he knows physically how he's going to feel after he eats it. But it's surprising the difference, change in eating habits, how it makes you feel. It really is.
Well, and I think if you have these tools, you know what all these measurements should be, you've talked to your doctor, Uh, you know where to turn for sound advice, and you put a little bit of time into planning and work in that exercise every day, and
Well, I haven't
you're
gotten
on
that
your
far
road
yet.
to.
I know the exercise is important, um, but I think, like what we were saying for seniors, it's even harder. Um, and during the summertime, it's probably easier to get out and walk, because it's nice out, it feels comfortable out. But as we get into the winter months now where it's darker and it's colder and we have the weather issue, I think that's a challenge for people to do those kinds of things.
Well, it is. And there's which we didn't talk about is vitamin supplementation. When you mentioned, that you can no longer walk outside, you don't get the sun. We've all read that we need to supplement vitamin D, which is called the sunshine vitamin. And you really do need to supplement vitamin D at the latitude that where we live here in Coeur d'Alene, Post Falls. Um, Even if you are out in the sun, which you can't really expose that much of your body when
No,
it's
because you got to stay
cold,
warm.
it's pretty hard to absorb enough sunlight to do the conversion of your vitamin D. And so we do recommend, I'm not going to mention any amount, but you can talk to your doctor about it. But I think most seniors should probably add a certain amount of vitamin D in the wintertime.
And they should probably, I would think that that would be something they would do even in the summer because a lot of seniors
Don't
don't
get
go
out.
outside, so it's pretty much the same. And
Correct.
and what does vitamin D do?
Well, it helps the absorption. It has to be present for the absorption of calcium, and it's involved in a lot of metabolic processes in the body. It's a fat-soluble vitamin. We do store it, but and so you can overdose on vitamin D. All fat-soluble vitamins, which would be A, D, E, and K, can be taken in too large amounts. But if you take a vitamin supplement and just take, an additional vitamin D without going over, I think 2,000 international units is probably a maximum that you should take. But I'm not going to make a recommendation because you need to talk to your doctor
Right, and
about it.
one of the things when I got my test results back from the doctors, that was one of the indicators on there was they measured the amount of vitamin D, and there was a range there where it needed to be, and at that point mine was low. So they can measure that to see where
Right,
you are,
they can measure that.
and then to kind of keep track of depending on
The-
how much you take where you're at.
And we don't really have a natural source of vitamin D in our diets. Fish oils, fish liver oil is one source, which they used to give children many, many years ago. But it's fortified in some foods, but it is kind of difficult to take in enough. The other source of vitamin D is the action of ultraviolet light, sunlight on your skin. And there's a conversion that takes place, and then that vitamin D passes through the blood and is converted into an active form in the kidneys and the liver. And then that active form is present that aids in the absorption of calcium in your diet. But it's a complex process, and
There's a number of vitamins that help your bones absorb the calcium because if you just took the calcium and nothing else, it may not absorb into your bones, so you're taking it for no reason.
and it's really wise to not take mega doses of anything because all things offset absorption and the action of each other. And so it's good to get your nutrients in your diet by eating whole foods and not processed foods. And you can pretty well do that with by having a variety of colors on your plate. You know, fruits and vegetables of yellows and reds and greens. Good lean meat and fish, and low-fat dairy products. I think the idea is to eat whole foods as much as possible. Foods that are grown locally are also a good recommendation. And in general, you really don't need to supplement. Seniors can end up spending a lot of money
Oh,
on
yeah.
supplements. And there is a little red flag there that you need to be concerned about.
Well, and I had seen something that talked about the foods with the boldest colors are the ones that's best for you. So when they talk about green, like lettuce and kale and stuff like that, the ones with the darkest greens are the
The
ones,
spinach and kale.
right? And I have heard a lot lately about pomegranates and how they can help lower blood pressure.
Uh, some claims are maybe exaggerated,
Okay.
but pomegranates do contain good nutrients, polyphenols, and bioflavonoids, and so forth. We hear all those terms. But again, eating the whole food versus even the juice.
Because there's a lot of fiber in the seeds of
There's
the
a lot of
pomegranate.
fiber in the seeds.
Okay. So the important thing to take away from all of this is when you go to your doctor and they take your blood tests, and when the person in the office calls you several days later and says, "Oh, yes, your numbers are fine," you're to tell them, "I want a copy of those results." And sit down and get your previous results, your numbers, and chart them all out and see what direction you're going in. Because if you're approaching the warning sign numbers, you could be getting to the metabolic syndrome, which is not a good thing.
And express your concerns to your doctor. I can't imagine anything more rewarding than for the physician to have you take charge and to ask these questions and to say, what can I do to get a handle on my own health? I think that is the way that that we all should probably
Absolutely.
participate in our own health and our own decisions.
Absolutely. And taking charge and addressing it before you run into trouble, that's going to save you money too. Because you're not going to have all of these healthcare bills for dealing with the results. So the four things was your glucose level needs to be below 100. For your cholesterol, your triglycerides shouldn't be any greater than 150. Your LDL cholesterol, which is the bad cholesterol, should not be over 135. Your HDL, which is the good cholesterol, for men should be 40 or greater, and for women should be 50 or greater. Your total cholesterol should not be over 200. And your weight, when you check your height and your weight on those BMI charts that you're going to go Google and see what the charts are, should not be any greater than 30. For men, your waist circumference should not be greater than 40, and for women, not be greater than 35. Your blood pressure should not be any higher than 130/80. Did I hit them all?
You hit them
Okay.
all.
So if you're approaching any of those numbers, it's time to start paying attention. And if you're over those, you really need to start doing something, because having all four of these conditions at the same time is putting you at greater risk for a whole lot of other medical problems. Is there any last words or advice you'd like to give Patty pertaining to this? Because I'm so glad that you brought this up to me.
Well, I would just say in closing that metabolic syndrome is a disease or a complex of diseases of modern civilization, but we can manage our diet and we can manage our activity, and seniors can prevent it.
Absolutely, absolutely. Well, thank you for being here with me this afternoon and talking about this.
You're very welcome, Connie.
And I hope that you folks listening out there really take this to heart and get your blood test results, start tracking where you are, and be healthier in the future. And I thank you again. This is Connie Clark with Home Helpers. You've been listening to the Senior Moment, and I hope you all have a wonderful rest of your weekend. Good day.